It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. Ataxia in dogs, what you need or should know. Have you noticed changes in the way your dog walks or stands? Perhaps he is suddenly acting drunk, or he is repeatedly shuffling, tripping, or falling. If so, your dog may be experiencing something called ataxia. Ataxia in dogs requires immediate veterinary attention to discover the root cause before treatment can begin. 1. What is ataxia in dogs? The term ataxia refers to a lack of coordination within the nervous system that causes abnormal movements in the legs, head, or body. There are 3 main types of ataxia in dogs. Proprioceptive ataxia. Conscious body awareness is called proprioception. Dogs with proprioceptive ataxia do not know where their limbs are in space. You may notice your dog dragging his toes, stepping on his knuckles instead of the bottom of his foot, wobbling and staggering. Proprioceptive ataxia is most often caused by compression of the spinal cord. Vestibular ataxia. With vestibular ataxia, your dog has balance problems due to a problem with the inner ear or brainstem. Signs can include abnormal eye movements, head tilting, standing with feet wide apart, and sometimes rolling over repeatedly. Cerebellar ataxia. Dogs with cerebellar ataxia often have difficulties with coordination and fine motor movement. As a result, they will have an exaggerated, high-stepping gait, often called obtuse gait. It is also common to have tremors in the head. When your dog makes a purposeful movement, such as lowering his head to drink water or pick up a toy, the head tremors can worsen. Cerebellar ataxia is caused by problems that affect the cerebellum, which is the part of the brain responsible for coordination and movement. 2. Causes of ataxia in dogs. Ataxia typically has a neurological cause. The possible causes of ataxia are the following. Intervertebral disc disease. A fibrocartilaginous embolus, which is sometimes called a spinal stroke. Infection in the vertebrae or the discs between the vertebrae. Inflammation or infection of the inner or middle ear, spinal cord, brainstem, or cerebellum, example, distemper virus. Tumors of the spinal cord, inner or middle ear, or brain. Trauma to the spinal cord or head. Degenerative myelopathy. Anything that compresses the spinal cord, such as a developmental abnormality or a narrowing of the canal. Underdevelopment of the cerebellum, cerebellar hypoplasia. Idiopathic vestibular syndrome. Examples of systemic causes of ataxia include hypothyroidism, electrolyte imbalances, and metronidazole overdose. It is important to note that ataxia is not the same as weakness or lameness, which would have different causes. If you notice ataxia in your dog, it's important to contact a vet as soon as possible. Some causes of ataxia can progress rapidly and lead to permanent paralysis or other serious complications. 3. Treatment of ataxia in dogs. Your vet will perform an exam to determine which part of the brain or spinal cord is affected. Additional tests may include blood and urine tests, X-rays of the back or skull, MRI, CT scan, and cerebrospinal fluid analysis. Referral to a veterinary neurologist is recommended. Physical therapy is also a common recommendation for dogs with ataxia. Some cases, such as spinal disc disease, may be better treated with surgery. For tumors, your vet may also recommend chemotherapy or radiation therapy. Some dogs require hospitalization to receive intravenous fluids and medications, at least at the beginning of treatment. 4. How to help dogs with ataxia. In some cases, the ataxia will improve over time. In other cases, such as cerebellar hypoplasia, the dog may be permanently non-toxic but stable. Still, in other cases, ataxia and other clinical signs may worsen over time and become severe enough to consider euthanasia. Many ataxic dogs can still have a good quality of life with appropriate home modifications. Be sure to block sharp corners and fall hazards, like stairs. If your dog has difficulty standing up while eating or has head tremors, you may need to hand feed him. If your dog seems to be in pain, be sure to talk to your vet about how to manage the pain. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend, and until the next video.